Good evening. My name is Dr. Ross Castile, and I'm the program director here at FranU. I wanted to take a moment to welcome everybody, say thank you for coming. We really appreciate your time and giving us the opportunity to show you what FranU is all about. The reason why I'm giving you a video recording is that unfortunately I had an unplanned surgery that I had to schedule that happened to land on today. So unfortunately I can't be there in person, but I am there in spirit with y'all. I'm doing fine. I'm recovering well. I'll be back. Don't worry. Nothing to worry about. And I'm really glad that we were able to keep this on the date that it needed to be. And based on the numbers, I'm assuming we had a pretty good turnout. I can't wait to hear all about it. And y'all are in very good hands. Dr. Callie Dorn and the rest of the faculty are going to make sure that everything is done well for you and show you around. And I hope you have a great time. And I hope you get a little bit of kind of taste of what we're about at FranU. So good luck to you. Have a good night. And I will see all of you hopefully very soon in the future. Good night.
To tell you a little bit about what tonight will look like, I'll give a short presentation just to tell you a little bit about us and about our program and some of the highlights. And then we'll break up into small groups and we'll tour around our facilities. And so a few of y'all will stay in here and talk about clinical rotations. So a lot of questions tend to come up about clinicals and where you may be placed. And so our Director of Clinical Education is going to answer some questions for y'all. We'll also break off into the simulation room, which is a lot of fun. You can see some of our tools, some of our toys that we get to play with, and some of the things that you will learn about if you are to be accepted into the nurse anesthesia program here. We'll also break off into another classroom, and you'll have an opportunity to talk to some students and faculty about just kind of our program in general, and just make sure you get all of your questions answered while you're here tonight. That's what we're here for. So I wanted to take a second to introduce ourselves, the rest of the faculty. I already kind of introduced myself. Also here with us tonight is Dr. Bill Schreider. Can you stand up for us, Bill? Bill is our research director here and chemistry instructor in the program. He does all things DNP project. He also teaches a lot of the online courses that you would take in the early semesters of the program. We would be lost without him as far as research goes, and so he has a big hand in our DNP scholarly projects and getting our students to that level.
I'm not a CRNA.
He's not a CRNA. Next is Dr. Amber Poirier. She's right here, Director of Clinical Education. Coming straight out of clinical site visits today. So she was in Jackson, Mississippi today, just rolling in. I texted her, I said, hey, you coming? She said, yeah, I'll be here screeching in on 2 wheels. So she does all things clinical rotations. And so I know y'all have a lot of questions about that. She'll stay in this room so that y'all can get those questions answered. Dr. Lindsay Williams. We finally get to call her Dr. Williams because she graduated last Saturday with her DNP. She's a graduate, and so is Dr. Poirier, a graduate of this program. And so she teaches a lot of the principles of anesthesia courses, simulation lab, and some of the clinical practicum courses. Mandy Broussard, Dr. Mandy Broussard is not here tonight, but she teaches our pharmacology courses. And if you speak to any of our students, she's a wonderful instructor, and we're really lucky to have her. Dr. Albert Swafford is also not here tonight. He teaches our physiology courses. He's also not a CRNA. He's a PhD in physiology, and he is an extremely good lecturer. He's way smarter than any of us, and we're just really blessed to have him. He's actually won the AANA Didactic Educator of the Year award, so he's fantastic. Dr. Beth Crochet was here late last night with a guest lecturer, so we let her off the hook for this event tonight. She also just graduated with her doctorate degree on Saturday with Dr. Williams. She teaches a lot of the principles of anesthesia practice courses, and she is our simulation coordinator for the program. Also extremely important people is Ms. Lynn Savoie here in the corner. She is our academic support coordinator. We could not function without her. She does all of your registering for courses. She does all of the scheduling and handling of our, OCD personalities. So we really appreciate her and would be lost without her. Tilly Parkins, you've probably been in communication with if you've made it to this event. She's our graduate recruiter. And so she is your point of contact if you need anything related to your application or, anything, questions with interviews. And if she doesn't know the answer, she knows who to point you to. So just to tell y'all a little bit about our program. So we started out in 2005 as a master's degree in nurse anesthesia with a small little group, and we have grown now to to accepting 40 students, and have grown to a doctor of nursing practice program in 2015. We've had over 400 total graduates with an all-time pass rate of 99.7% on boards. So we're very proud of that. We're very proud of our graduates. We think we produce some of the best CRNAs in the United States of America. But and we just really pride ourselves on being able to produce really strong students that can come out and practice well clinically and of course pass their board exam. So to tell you a little bit about kind of how the program is structured, it's a 36-month program. The first 2 semesters of the program are online. Most people are able to work full-time and live wherever they call home. We have quite a few who decide to stay wherever they live, and then they come to campus in August when the big didactic portion of the program begins. So able to work full-time as a registered nurse while you're completing those couple of online semesters. It's a total of 100 credit hours. We have some online courses, like I said. We have some blended courses where we do a portion online and a portion where you come on campus for some intensive experiences, some hands-on experiences. And then we have some face-to-face courses, and then of course clinical instruction where you're going to different clinical sites later on in the program. Our students complete a final doctorate of nursing practice scholarly project. Our students are currently doing a systematic review of the literature, and they start that project in the fall of the 2nd year of the program, and they finish it up just prior to graduation in the summer of their 3rd year. So it's a great opportunity to be able to dive into the literature and really look at evidence-based practice and translating this research finding into practice change. Our students do over 2,500 hours in clinical rotations. The COA requires 2,000 hours. Our program requires 2,500. We think it's that important, that extra 500 hours of clinical experience. Those experiences are obtained in Louisiana and Baton Rouge. Some sites are in Mississippi. Some sites are in Lafayette, Ruston, Monroe. Help me out. Where am I missing? New Orleans. Yep. New Iberia. So we have 18 clinical sites that we partner with to get you guys the best clinical experience possible. So this just kind of breaks down a little bit. We don't really technically call it phase 1, 2, and 3, but I felt like it was a good way to kind of summarize what our learning experience looks like. So that phase 1 is your first 2 semesters of online classes where I said you could live and work, or work where you currently call home. And then phase 2 is our didactic portion of the program, which these guys are in the middle of right now. They can tell you it's pretty intense. It's, every day in the classroom, lecture, studying when you're not in lecture. And then the phase 3 of the program is where, also in phase 2, there's the simulation courses that prepare you for your clinical education. Phase 3 begins in the summer of your 2nd year of the program, and that's when you start rotating out to different clinical sites. It's a 5-semester long portion of the program. During that phase, you have typically 1 didactic course with clinical rotations and an online DNP class. And also at that time, we start to incorporate board preparation so that when you come out, you're ready to go and take your board exam as soon as you graduate. So what we're all kind of here for is admissions, application questions, interviews. And so I just want to tell you a little bit about what we kind of look for in a student. Obviously, if you're here, you've probably looked at our admissions requirements. You have to be accepted into the program or to be offered an interview, you must be a BSN prepared registered nurse working in a critical care unit. We require a minimum of a year in the critical care unit, prefer 2 years. And we have begun accepting or considering experience like PICU or NICU, provided that you can demonstrate the ability to take care of an adult critical care patient. So we need you to know things about ventilator management. We need you to know things about vasopressors. We need you to know things about the pathophysiology of the patients that you're taking care of. So provided that you can demonstrate that experience, we are willing to accept other ICUs. As far as the GPA, your 3.0 is your minimum GPA. I'll share with y'all some of the statistics from last year's accepted class, so we'll kind of give you an idea of where our typical GPA usually falls. But 3.0 is what you need to have to be considered for an interview. Other things that we consider, emotional intelligence is what I like to kind of call that like it factor, the ability to be aware of your emotions and handle your emotions effectively, and especially as it relates to the professional workspace. So lots of businesses have studied this and found that people with a high emotional intelligence are just more successful in business, more successful in graduate school, more successful in their professional endeavors. And so you will, once asked to be interviewed, you will complete an emotional intelligence assessment. It's an online assessment that takes about 15 minutes or so to complete. And it gives us a little bit of insight into your emotional intelligence. Also, as a part of that, we do ask some questions in the interview that are tailored towards your emotional intelligence and helping us to tap into that kind of facet of yourself. Another thing we consider is your science GPA. So it's not a requirement, but it is something that we look at. Your heavy science courses, your biologies, chemistries, physiologies, things like that. We want to see how you performed in those classes, because that first didactic semester, those first 2 didactic semesters are heavy pharmacology, physiology, chemistry. And so we need to know that you're going to be able to perform well in those courses. Your last 60 hours of coursework. We frequently run across students whose overall GPA may not be stellar, but you can look at their like nursing school GPA and you can tell that they really got it in. They really kicked it into gear whenever they decided what they wanted to do with their lives and got into nursing school. So we like to look at the last 60 hours as kind of a gauge of how well you'll do in graduate school as well. A clinical knowledge evaluation. And so we want to know who you take care of and how comfortable you are with those patients. I don't think it's anything really complex. We let you lead the way as far as that goes. If you tell me you know how to take care of a liver transplant, better be able to answer some questions on liver transplant. So I think, we try to let you guide the way about, the patients that you feel most comfortable taking care of and the patients that you feel most comfortable talking about. Same thing goes for pharmacology. We want to know that you're at the bedside in the unit, and you know what you're giving and you know how it works in that patient. That'll be my best advice is to really be familiar with those patients that you take care of every day, know the pathophysiology of those diseases, know the pharmacology of those drugs. And would you guys agree they've been through this before?
100%. That's a lot more advice than
CCRN certification status. It is not a requirement for your first time applying to the program. You do not have to have your CCRN. If you're applying for your second time, you do have to have a CCRN certification. We highly recommend that even if it is your first time applying, that you get your CCRN. We find that it's very, shows initiative from our perspective. It shows initiative. It shows the ability to pass a difficult exam, and it shows that you're knowledgeable about critical care. So we do recommend it. The GRE, we do not require the GRE anymore. 2 years ago when COVID hit and became really difficult to get testing sites, we had already been considering not requiring the GRE, and so we decided not to at that time. With that being said, if you've taken the GRE and you got a really good score, please upload it. It looks good for you. If you took the GRE, if you didn't get a great score, don't have to upload it. So we will take a look at it though. This is some statistics from our last admission cycle. We got our largest application pool ever, 286 applications. We offered 177 interviews. We accepted 40 students. The average GPA was 3.335, and the science GPA was 3.5 for that group. And so this is kind of, what are our important dates? What am I going to see when I walk in the door when I come for an interview? The dates that I want y'all to be familiar with are the July 1st application deadline. Make sure that you have all of your materials in by that date. We're not flexible on that date. Once those applications hit, we've got to start reviewing everybody's. And as you can see, with 286 applications to review, it takes quite a while. And so that July 1st date is firm. Our interviews will be conducted in person. The last 2 years, we weren't able to interview in person, and we're happy to be able to get back to that this year. So our interviews will be the 15th through the 19th or the 22nd through the 26th. Our applicants sign up through a bookings link. It's a Microsoft Bookings application. So you'll be able to sign up for a slot and manage your appointment that way. So what to expect when you're here for your interview? You'll come in that main door over there by us and Lane. You'll meet Ms. Lynn, and you will check in, and we will take you back to a conference room where you'll meet with 3 to 4 faculty members. It may be faculty, it may be clinical coordinators. We like to kind of pull in some of our clinical affiliates to help us make determinations on who we think would be a good fit for our program. So 3 to 4 members of the faculty and or clinical affiliates will be there. I've already kind of told you the types of questions to expect, but really we want to get to know you. We want to know if you're a fit for our program and if we're a fit for you. I think that's an important thing for you guys to remember, that y'all are interviewing us just as much as we are interviewing y'all. And so ask a lot of questions, come prepared with some good questions, because this is, it's 3 years of your life that you're going to invest with us. And so make sure that you come with some good questions for us as well. We'll ask you some get to know you kind of questions. Where are you coming from? What's your experience like? We'll ask you some emotional intelligence questions to try and tap into that and see how we think you may handle stress. We experience quite a bit of stress as anesthesia providers, so we want to know that you can handle that. And then also the clinical knowledge portion of the interview, I would say is a pretty brief portion, but an important portion of the interview as well. You can expect it to last about 40 minutes, face to face with the faculty. And then we invite you to go meet with our students, who will let you tour around the simulation lab and answer questions. Again, they can answer questions from a different perspective than we can. Any questions about that? And after this presentation, you'll have an opportunity to, ask anything that you want about these, our interviews. And that's pretty much it for my portion of the presentation. We will kind of divide up into groups here, and Dr. Poirier is going to stay here with Zoom running so that our guys who are virtually attending can hear her questions, because that's kind of a hot topic. Everybody wants to know about clinicals. So she'll stay in here, and then we'll break off into groups and head into the simulation lab and into the classroom so that you can speak to some of the students and faculty. And follow us on social media. FranU CRNA, FranU_CRNA is our Instagram, and we're on Facebook. We're trying to put a lot of cool things that we do as a program. If you follow us already, you'll see we did a guest lecture on ultrasound guided regional anesthesia last night. It was really cool, very hands-on. So we try to put cool things that we're doing as a program so that y'all can kind of see what we're all about. Thank y'all so much for joining us.
Okay, well, it's just us, and so let me just kind of briefly explain a little bit about who I am. I know that Dr. Dorn kind of just briefly did that, but I'd like to just give you a little bit of information. Again, I'm Amber Poirier, and the Director of Clinical Education here at FranU. Fun fact, I graduated. I was part of the 3rd program. We were still at MSNA program at that time. And so this is kind of my heart. And way back then, it was Our Lady of the Lake College. And so nobody even talks about Our Lady of the Lake College anymore, because now we're FranU. And so with that said, I think that it probably speaks volumes when you see faculty here that graduated from the program, because it's truly a product that we believe in. It's a process that is rigorous. And sometimes you may doubt your decision making and your kind of choice to proceed with anesthesia. But I assure you that the process is well worth it. And so, you know, at the end of that kind of whole ordeal, you will feel very accomplished and you will feel ready to do anesthesia at any place, any hospital, any surgery, any facility. And that's why that keeps us going, because that's what we're trying to achieve, and that's what our goal is. I've been here for probably about 7 years, and so kind of born and raised here, kind of outside of Anesthesia Parish, it's just about 30 minutes away from here, and you know, kind of married my high school sweetheart, went on and had 3 kids. I have a senior in high school, and then a sophomore going into a junior, and then I have a 3rd grader. So we have a lot of dogs. I happen to be a dog person. If anybody wants to know what kind, I don't know if you're prepared to understand what the answer is. I have a golden doodle, I have a labradoodle, I have a lab, and we have a golden retriever. So I think we got all the spectrum of the retrievers. And so, anyways, but that's kind of my crazy life outside of work. And so what I'd like to kind of do is just kind of briefly tell you a little bit about the clinical experience here at FranU. It's something that I'm extremely proud of, that partnerships that we've built over the last 5, 7 years, even 10 years, they're just getting better and better. And so just as the slide shows, we have 18 clinical sites. I would say probably almost 50% of those sites are in this close region within 30 miles or so. And then the other remaining half will be in Lafayette areas, which is about an hour 20 minutes away from here. Then we have some in the New Iberia, kind of Crowley area, that might be closer to 2 hours. Then we have some in Ruston. And I know that many of you may not be from Louisiana. That's why I'm kind of giving you just a little visual kind of understanding of where our sites are. But then we have something in northern Louisiana, Ruston and Monroe. That's probably about 4 hours from here. And then we have one site in Jackson, Mississippi. That's probably about 2.5 hours. And so when you come into the program, probably the understanding is that you will probably have to travel at least 4 to 6 months during the 18 months that you're in clinical. And so probably the most common question is why? And there's several reasons why we ask that you travel. So one reason is that, and this is pretty much the trend across the nation, but much more so here in Louisiana. When you get into the metropolitan areas, CRNA scope of practice is probably a little bit more limited than in the rural areas. The rural anesthesia areas, about northern Louisiana areas, a little bit in Mississippi kind of areas, those are kind of more rural. And when you kind of go into those areas, the scope of practice is full and it's unrestricted. Here, like in the Baton Rouge region, you probably have about 30% of the facilities, the hospitals, where CRNAs have full scope of practice. The remaining 70% CRNAs have limited scope of practice. And so I don't think it does anyone good to stay in this area and learn restricted scope of practice, okay? And so whenever I send you out to those areas, you start really understanding the value and the worth of a CRNA. And that value and worth is that you could do any anesthetic that an anesthesiologist could do. And so, and I think that the best way to accomplish that sense of value and worth is by going out to those sites. And so Zach here has went to northern Louisiana. He stayed there for at least 2 months, am I right? 2 months. And so he can kind of tap in a little bit, and I'm sure that he could probably speak to a little bit of the differences in rural anesthesia versus metropolitan, okay? And so, of course, our flagship hospital is right across the street, out in the lake. It's a huge, maybe 400, 500 regional medical center, and it does everything. It's a level 1 trauma center. The only service that it does not provide is OB, and so no OB services at the hospital. But level 1, meaning gunshot wounds and knife stabbings and things like that. They have their own individual cardiothoracic tower, so where they do all cardiovascular and thoracic surgeries. And then they have a tower side, and that's all predominantly neurosurgery and orthopedics. And then they have a main side, and that's all your kind of abdominal surgeries, GU, things like that. And so overall, probably about 40 anesthetizing locations just in that one regional medical center. So the majority of our students will start off there, and that's where you kind of learn some basic skills. And then once you kind of get your, acclimated to the basics of anesthesia, then you'll start going off into these different clinical sites to get more broader kind of experiences. And so with that said, a typical clinical rotation schedule will be such that you will attend clinical 4 days a week. And so we usually kind of identify the shift as like a 7 to 3 shift, but in all honesty, you're probably getting there closer to 5:30 in the morning to help set up the room and prepare for the case. And then sometimes you leave after 3. I think that it varies, but on average, I think that most people are spending probably about 10 to 12 hours a day in the OR doing anesthesia, which is great. And so then the remaining 1 day will be used for didactics, and that's when you'll either have classes scheduled, workshops, things like that. We do have a period of your clinical rotations where one would do off shifts, and those kind of shifts are more like your 12-hour shifts. You're doing weekends, nights, evenings, things like that. And that's a COA requirement that you all have exposure to some off shifts. But that's only about 2 months of your whole 18 months of clinical. And so that's kind of the gist of, in a nutshell, very briefly. I don't want to hijack because I think we only have about 15 minutes of this whole kind of session. So I don't want to hijack the topic. I'd much rather be able to have you ask me questions and I can answer them. So feel free, take it away. Anything you want to know?
I have a question. Okay, so if we travel, like say we go to Ruston, how, like living wise, how does that work? Are you just in charge of finding your own living? Or?
Yeah, so whenever you kind of become a student of the program, and that is part of the terms that you agree to, that, that the program is not responsible for any housing, and they don't provide any housing, and that students have to find the housing on their own. Luckily, just for the last 5 years, students have kind of assembled a good list of housing that is really routinely made available to the student, and students just know in advance. Usually something that I've done new within the last 4 or 5 years is that I now am giving you your clinical rotation schedule for the whole year. So when you start in July, the second year, you know where you're going to go until you graduate. And so every once in a while there's a little change here or there, but for the most part it'll stick to it. And so that way you have plenty of time to arrange for housing. I do try and put people together that you could room with so that you could share the cost. And so most commonly you'll see about 3 or 4 students will travel together, and so they could split the cost 3 or 4 ways, and that helps. And that's hard, right, for a program director, clinical director to ask you to pay our tuition. And then we're going to be like, oh yeah, by the way, we're going to get you to pay for housing too on these months that you have to go out. And it is hard. And even I as a student might have thought that was a hard thing to kind of swallow and accept. But in the grand scheme of things, now that I'm a CRNA, and so I don't have the lens of a student, I will tell you that, and hopefully, I don't even know Zach's quite there yet. You probably have to be a CRNA before you get to this point. But, if you're going to pay $102,000 for tuition, let's just say, probably to go out to a site like in rural anesthesia areas, you probably split it with somebody, you might come out with $1,000. So if you're going to get a loan for $100,000 or $101,000, probably the grand scheme of things, not that significantly different. So if you could just kind of hold on to that thought, and again, as a student, I know $1,000 is a lot, but when you're paying back loans and you're living on loans, in the grand scheme of things, and I think the experience that you get from going there, and I've always told Zach this, and there might be few people that might not embrace the traveling as much as others, but I can tell you, almost every student, I don't want to go there. I don't want to go to Mississippi. I don't want to go to Norfolk. I don't have this. I don't have that. I don't have this. And then, kind of push them, and then after the rotation, they come back and they stay in the office. Okay, can I go back? I want to go back. And so that is the most common response that I get from a student. So it is daunting to think that you have to go move away from your family, or some of you might have children. But I will tell you that the majority, if not almost 100% of the students will come back. You know what, can I go back? I'd like to go back in 2 months, because that site was so great, because they really start seeing the value and the worth of the CRNA, and especially when you practice into the full scope.
I think part of it is when you go to those rural sites, they don't see many students. So when you get there, they kind of treat you like royalty. Like, here's a cafeteria, here's how you get free food every day. We're so happy to have you. What can we do for you? You know? So it's refreshing for them to get students, and then they treat you great. So everyone ends up loving it, you know?
So good question.
I have a question about like the rural sites. Like, what kind of like procedures are they, like these like hospitals like full of ORs, or is it just like
Full ORs.
Okay.
Full scopes. I mean, like on the site that I visited today was Jackson, and Jackson's a little bit more probably suburban. You know, it's not completely metropolitan, but it's still very rural anesthesia kind of feel to it. But they do cardiothoracic neurosurgery. They have a burn unit. They do all your major surgeries and pediatrics and hearts, lungs, and so yeah, full scope. What other questions?
So when you say full scope, that means there's no anesthesiologist?
So they're usually anesthesiologists, and that's usually predicated on a hospital establishing that mandate that anesthesiologists be in. And it's usually in hospitals that do these kind of high acuity cases, cardiothoracic neurosurgery, OB. Anytime you have those like patient populations that are deemed high risk, hospitals usually mandate that an anesthesiologist, but usually how that role is that they're very hands-off, and that the CRNA's full scope of practice is that they are doing the pre-op, they're designing their anesthetic plan, they're delivering the anesthetic plan, they're doing all the regional anesthesia that's associated with it, and so they're making all decisions on their own. And so, you know, when you kind of come to more of the metropolitan areas, with a few exceptions, for instance, at Our Lady of the Lake, the CRNAs do not have scope of practice in their being able to do central lines or any kind of regional nerve blocks. And so it's just not the scope of practice there, which is very common in a city. Any other questions? You want to back from questions? We just got back from one of our northern Louisiana sites. And so what other sites have you gone to, Zach?
New Iberia.
New Iberia, another rural.
Fantastic.
Yes, that's one of our sites that we actually have an anesthesiologist that will actually do primarily the one that's teaching the CRNAs or the students, the regional nerve blocks. Fantastic. He's very pro-CRNA. He's a CRNA advocate. And so very, very supportive of our students.
My experience is in every hospital, the CRNA practices a little differently. So by you going to 6 different ones, you learn 6 different ways. And then when you come out at the end of it, you can pick and choose what you liked best and where you want to go. So I think it would be a disservice to stay at one place the whole time instead of getting all that experience at a ton of different places.
Yeah, I think I totally echo that. And you'd be surprised how there's regional differences in how you do anesthesia. So New Orleans does anesthesia different than North Louisiana versus Baton Rouge. And it's weird, like it's anesthesia. And really what you'll learn is that there's 1,000 recipes, same outcome, you know, pain-free, awake, not nauseated, you know, no complications, but there's 1,000 ways in which you could deliver that anesthetic. And so each region tends to kind of hone in on a certain technique. I just actually had a clinical coordinator this morning from St. Francis. We were on the phone talking, and he was saying, oh, I love the students coming here. You know, I didn't train on Precedex. And I had a student that was teaching me how to do Precedex for pediatric wake-ups and things like that. And so it's because those students have been to one area where that's how they practice in a whole different region, and then they go up north and they're able to show those practicing CRNAs that have been there for 20 years a new technique. And so that's rewarding. That's rewarding for a student and also for the CRNAs to be able to have that two-way kind of learning opportunity. And so you'll see that a lot. Anything else?
So, when we do start going to the clinical side, is it on our first day that we do start being hands-on, or is there like a week or something that we shadow? How does that normally go?
So the question is how do we onboard students for clinical practice? And so you will spend the whole entire spring semester doing simulations. So we'll try and simulate an anesthetic and a surgery. And so that'll be your first kind of glimpse of what the flow of anesthesia is. And then we'll continue. Ready?
No, about 5 minutes.
Okay, perfect, yep. And then after that whole simulation period, and that, of course, it's a didactic class, so it spans for the entire spring semester. Then we'll start onboarding you into the hospital, and what that looks like, we'll get you back into the sim lab, make sure that you got your flow down, starting from induction all the way to emergence, and then we'll bring you to the hospital. You'll observe 1 or 2 days, and you'll just observe, not do anything else. And then maybe the next time you'll kind of start doing masking and things like that, just more basic airway management. And then within the week, you'll be doing the full induction airway management. And then of course, from there, it just evolves. Every student kind of acclimates at a different time frame, and there's no right or wrong way. You know, some students might take 3 months to really get comfortable with intubation. Some students get it in 2 weeks and they're just, you know, real comfortable. That never, ever means anything, you know, because by the time you graduate, everyone intubates, everyone does nerve blocks, everyone's doing central lines, and no one's having to rely on any kind of feedback or guidance from an anesthesia provider. You'll be doing this independently. And so however long it takes, everyone's different. And as long as patient safety is being maintained and being held, the faculty are not worried, you know, so that's kind of how that looks like. Yeah, and so Ms. Lynn was telling me about maybe a good thing to kind of, you know, make y'all aware of is that because we understand that living is costly when we go to these sites, your faculty works tirelessly to apply for grants from the federal government that can be used for funds, traveling, housing, lodging, things like that. And so every year we apply to them, and you know, sometimes we get more money than we expect, sometimes we get less money. It's hard to determine. It's really all based on budget from the federal level. But on average, I would think that most people get $1,500 to $2,000 in grant
I
money.
think we got more than that.
Yeah, okay.
I think we got 3,000
Okay.
because we got 2 last semester and 1 this
And then
semester.
1, and
So
so,
that covered my travel costs.
yeah,
At least the rent, you know,
Right.
so then I'm paying for food anyway, so.
right. And so that is something that we're very happy to do, and we will continue to do that as long as there is a grant available. Your faculty will continue to apply for them and get whatever monies we can get from the federal government to kind of hand out to students to help with some of these housing costs. And so may not cover everything, but it'll be something that will kind of lessen the burden. So yeah, thank you for reminding me, because I think that's important.
And there was even a student this year who he and his wife and child lived in an RV and they traveled
Yeah.
site to site.
Yep. And so, any other kind of questions? All right. Well, again, welcome, and thank you for taking the time out to come listen to us and learn about FranU. Of course, we'll have another station. The Sim Lab is fantastic. And so you'll kind of get a little bird's eye view of just all the fun technology that we have coming our way. Most of that technology has been, again, awarded to faculty because we apply for any money that we could get, we apply. And that takes a little bit of time, but it's worth it for us. And so we've, you know, most recently, I did an endowment and I was awarded $350,000 to spend on technology that we're using in Sim Lab. They haven't got to play with it yet. That's coming in the fall, but it's all about POCUS, TE, TTE, and so a lot of ultrasound kind of diagnostics that
Okay, I'm sorry I'm busting in on the session. I'm Tilly Parkin. I'm the graduate coordinator. I hope y'all can hear me. Thank you all so much for joining us this evening. I know the virtual option started off a little rough, so please know we've recorded everything. We also have a tour of our simulation room recorded, and we're putting that all together, and we will send it out to everyone that joined tonight. I'm about to just put some contact information in the chat. Thank you again for everybody that joined tonight. If you have any questions that you want me to get answers for you guys, feel free to email me or call me, and I'll be happy to compile those questions as well when we send that out next week. And again, thank you all so much for attending and bearing with us with the sound issues, but we will get the video recording out to you next week. And we look forward to seeing your application soon. Y'all have a good night.